Welcome to ArcTraco YouTube channel.
Hello there, let's talk about overview of pharmacy practice. Introduction to pharmacy. Definition and scope of pharmacy. Pharmacy is a health science discipline that involves the preparation, dispensing, and proper use of medications. It encompasses a broad range of responsibilities, including patient care, medication management, and public health. Historical perspective. The roots of pharmacy can be traced back to ancient civilizations where healers and shamans practiced the art of preparing medicinal substances. Over centuries, the role of the pharmacist evolved, and formalized education and regulation emerged. Evolution of pharmacy practice. Pharmacy has transformed from a craft-based profession to a highly regulated, patient-centered practice. Advancements in pharmaceutical sciences, technology, and healthcare delivery have shaped the modern landscape of pharmacy. Pharmacy education and training. PharmD programs. The Doctor of Pharmacy, PharmD, is the professional degree required for pharmacy practice. PharmD programs provide a comprehensive education covering pharmaceutical sciences, clinical practice, and patient care. Licensing requirements. Pharmacists must obtain a license to practice, which involves completing a PharmD program, passing licensure exams, and fulfilling any state-specific requirements. Licensing ensures that pharmacists meet the necessary standards to provide safe and effective care. Continuing education. Pharmacy professionals engage in ongoing learning to stay current with advancements in pharmacotherapy, technology, and healthcare policies. Continuing education is crucial for maintaining competence and delivering high-quality patient care. Roles of a pharmacist. Dispensing medications. Pharmacists are responsible for accurately dispensing medications prescribed by healthcare providers. This involves ensuring the right dosage, proper administration instructions, and checking for potential drug interactions. Patient counseling. Pharmacists play a vital role in educating patients about their medications. This includes providing information on dosage, potential side effects, and answering any questions patients may have. Effective communication is key to promoting medication adherence. Medication therapy management. Pharmacists collaborate with healthcare teams to optimize medication therapy. This involves assessing the appropriateness of drug regimens, identifying and resolving medication-related problems, and ensuring positive patient outcomes.
Pharmaceutical care, patient-centered approach. Pharmaceutical care places the patient at the center of the healthcare process. Pharmacists work collaboratively with patients to ensure that medications are safe, effective, and used appropriately to achieve therapeutic goals. Establishing relationships with patients. Building trust and rapport with patients is integral to pharmaceutical care. Pharmacists strive to understand patients' health goals, address concerns, and provide individualized care. Monitoring and optimizing drug therapy. Pharmacists continuously monitor patients' responses to medications, adjusting therapy as needed. This proactive approach helps prevent and resolve drug-related issues, improving overall patient outcomes. Pharmacokinetics and pharmacodynamics. Drug absorption, distribution, metabolism, and excretion. Understanding how drugs are absorbed into the body, distributed to target tissues, metabolized, and excreted is crucial for determining appropriate dosages and predicting drug actions. Mechanisms of drug action. Pharmacodynamics explores how drugs interact with receptors and cellular processes to produce their effects. This knowledge guides the selection of medications based on their mechanisms of action. Drug information and communication. Retrieving and providing drug information. Pharmacists are experts in drug information. They use various resources to retrieve information and provide evidence-based guidance to healthcare providers and patients. Effective communication with patients and healthcare providers. Clear and effective communication is fundamental to pharmacy practice. Pharmacists must convey complex information in a manner that patients can understand while also collaborating with other healthcare professionals to ensure coordinated care. Pharmacy law and ethics. Drug regulations. Pharmacy practice is subject to legal regulations governing the manufacturing, distribution, and dispensing of medications. Compliance with these regulations ensures the safety and efficacy of pharmaceutical products. Professional ethics and responsibilities. Pharmacists adhere to a code of ethics that emphasizes integrity, honesty, and patient well-being. Upholding professional responsibilities is essential for maintaining public trust. Controlled substances and prescription requirements. Pharmacists follow strict protocols when dispensing controlled substances, which have the potential for abuse. Compliance with prescription requirements helps prevent misuse and diversion. Patient safety in pharmacy. Medication errors. Pharmacists employ rigorous systems to prevent medication errors, including double-checking prescriptions, providing clear labeling, and implementing technology to enhance accuracy. Adverse drug reactions. Monitoring and reporting adverse drug reactions contribute to ongoing pharmacovigilance efforts, ensuring that the safety profiles of medications are well understood. Quality assurance in pharmacy. Quality assurance programs are implemented to maintain high standards in pharmacy practice. This includes regular audits, ongoing education, and continuous improvement initiatives. Pharmacy management. Inventory management. Efficient inventory management ensures that pharmacies have an adequate supply of medications while minimizing waste and maintaining proper storage conditions. Financial management. Pharmacy managers oversee financial aspects, including budgeting, billing, and reimbursement. Financial sustainability is essential for the continued provision of high-quality care. Human resource management. Pharmacy teams are diverse, including pharmacists, pharmacy technicians, and support staff. Effective human resource management fosters a positive working environment and enhances patient care. Pharmacy technology. Automation and robotics. Pharmacy automation, including robotic dispensing systems, enhances efficiency and accuracy in medication dispensing. Automation also allows pharmacists to focus more on patient care. Electronic health records. Integration with electronic health records. APROS facilitates seamless communication between healthcare providers and enhances the coordination of patient care, specialty areas in pharmacy. Clinical pharmacy. Clinical pharmacists work directly with healthcare teams, participating in patient rounds, providing drug therapy recommendations, and managing complex medication regimens. Ambulatory care pharmacy. Ambulatory care pharmacists focus on providing care in outpatient settings, collaborating with primary care providers to manage chronic diseases and promote preventive care. Geriatric pharmacy. Geriatric pharmacists specialize in the unique medication needs of older adults, considering factors such as polypharmacy, age-related changes, and multiple chronic conditions. Pediatric pharmacy. Pediatric pharmacists tailor medication regimens to the specific needs of children, considering age-appropriate formulations and dosages. Public health and pharmacy. Immunizations and vaccinations. Pharmacists are involved in administering immunizations and vaccinations, contributing to public health efforts to prevent the spread of infectious diseases. Health promotion and disease prevention. Pharmacists engage in health promotion activities, offering advice on lifestyle modifications, preventive care, and screenings to promote overall well-being. Global pharmacy practice. International pharmaceutical regulations. Pharmacy practice is influenced by diverse international regulations, requiring pharmacists to stay informed about global standards and guidelines. Challenges and opportunities in global pharmacy. Global pharmacy practitioners face challenges such as disparities in medication access and cultural differences. However, collaborative efforts present opportunities for sharing knowledge and addressing global health issues. Emerging trends in pharmacy. Precision medicine. Precision medicine tailors treatment based on individual characteristics, including genetics. Pharmacists play a role in implementing and interpreting genetic information to optimize drug therapy. Pharmacogenomics. Pharmacogenomics explores how genetic variations influence drug responses. It offers insights into personalized medication regimens. Telemedicine. Advancements in telemedicine enable pharmacists to provide remote patient counseling and consultation, expanding access to healthcare services. Professional development. Continuing education. Pharmacists engage in lifelong learning through continuing education programs to stay abreast of evolving pharmaceutical sciences and healthcare practices. Professional organizations. Membership in professional organizations provides pharmacists with networking opportunities, access to resources, and a platform to advocate for the profession. Certification and specialization. Certifications and specialized training allow pharmacists to demonstrate expertise in specific areas, such as geriatrics, ambulatory care, or infectious diseases. Thank you for watching ARC Tricoa Creating Future.